We are going to have Dr. Mahesh, who is going to speak on do we need to investigate optic neuritis routinely? He's going to talk for no. People who heard him speak in Hall 7, just forget it.
Okay, so first I would like to thank Dr. Ambika for having invited me in this instruction course. So my argument will be, I'm little changing the topic. Every case of optic neuritis should be investigated, imaged and evaluated. No. So I will explain each one. I would like to thank Dr. Durga Priyadashini for giving an overview of optic neuritis, and she has made my work simple. She has told which are the atypical features, she has told clearly, and I'll be building on what she has told. So my focus will be not every case needs a workup. Focus is on every case. Extensive workup. That is the next statement I would like to make. I am not contesting the fact that I'm not telling that extensive workup needs to be done for lengthy blood workup, LP, and I'm not contesting the fact that every case needs a contrast MRI brain and orbits in the case of optic neuritis. There is no doubt about that. But what I'll be contesting is every case don't need this workup, and every case does not need an extensive workup like a lengthy blood work, like all the extensive tests Dr. Durga has beautifully brought out in the appropriate situations, and a lumbar puncture need not be done in every case. So in order to evaluate these patients, we need to know the natural history of this optic neuritis, which has been appropriately told by Dr. Durga. So typical optic neuritis, majority of the patients recover, has been told by the optic neuritis treatment trial, and it has also found that blood investigations are not very helpful. Then all the blood workup required according to the ONTT study is only relevant to the steroid use like blood sugars and not extensive workup. There are very clear clinical features of atypical optic neuritis, as has been told before. It has to be recurrent, it has to be steroid responsive, or it is steroid dependent, or it is bilateral. And these are the clear defining clinical features of a atypical optic neuritis. And once we see these patients clinically, we take the history itself, we have a fair idea of whether this is going to be a atypical or a typical optic neuritis, and we can always tailor our investigations based on our clinical examination and history. Also, not only clinical, we also have clear radiological findings with respect to atypical optic neuritis. As seen in this picture, it has got a bilateral extensive optic nerve involvement. More than 50% of the optic nerve length has been involved in both the eyes. Here also there has been extensive optic nerve involvement here. More posterior involvement of the optic nerve as seen radiologically. Again points on atypical presentation, or a longitudinal extensive spinal cord involvement. So once we see all these radiological findings, in addition to the clinical findings, we know that whether this needs really a extensive workup or not. So we need not do it for every case. So there was one Indian study which was done in 2014, where they studied 99 eyes of 83 patients for a period of 3 years. And they did all these blood investigations, and they found it to be normal in the majority of the patients. And they found recurrence to be only 16% of the cases were recurrent. And majority of the patients recovered with a reasonably good visual acuity. There's another Indian study. I'll be quoting the same study which Dr. Durga has told, and we have seen that majority of the patients do not fall under the, almost half the patients are typical optic neuritis. So less than half only falls under atypical optic neuritis, and majority of the, out of those 50%, 21% did not progress at all, and it was monophasic as per their study. So based on all our Indian studies, we can fairly evolve an algorithm. We need to do a contrast enhanced MRI, and if there is poor visual recovery, then we can go for testing for NMO, IgG. If not, and not in every case. And if there is recurrent, again we can do a repeat testing for NMO and do a repeat MRI brain of the spinal cord and the brain, and with that we can decide whether these patients will require more extensive blood testing. So in conclusion, For us to decide whether all these patients need, we need to see the relevance of these investigations in every case. Each and every case is separate. We need to see them case by case. And we also need to remember that in our country, we need to have resource utilization, time utilization optimized. And also we need to factor in the cost for our under-resourced population. Thank you.
Thank you, Dr. Mahesh. And I think we can just summarize this topic. And if it is a typical optic neuritis, probably you can just watch the patient with the routine ONTT protocol and you can treat it. But if it is atypical, any of these findings, but if the same patient first attack bilateral event with an atypical features, you have to escalate the blood investigation, CSF and the imaging. As simple, you need at least an MRI is preferably better to get for an MRI, and there's no role of CT in optic neuritis. So that is a very important point which you have to consider. And if at all a patient has an atypical optic neuritis features, you have to get all the atypical workup. And if a patient has a prior history of any fever or any exposure to one infection, he needs an extensive infective workup panel also. That's what I would consensus. And maybe seromarkers are going up in the literature, so we need that also to be added in most of our optic neuritis.